Hi everyone, I'm Jen. I'm a nurse practitioner, and today we're tackling one of the questions I hear most in my practice. Does my child have strep throat, and do they need antibiotics? Here's the thing. I see so many families who are absolutely convinced that their child has strep because they have a sore throat, fever, they have body aches, and they just assume that it's always strep. The truth is, distinguishing between viral and bacterial throat infections isn't always straightforward, especially in younger children. And getting it right matters because if we need an antibiotic, we need an antibiotic, but we also need to avoid them when they won't help. So today I'm going to share exactly how I evaluate these cases in my office, including some surprising presentations of strep that might catch you off guard. By the end of this video, you'll be so much better equipped to know when your child actually needs to be seen for possible strep, and we'll talk about treatment plans. Okay, first let's get clear on what we're dealing with. Strep throat is caused by group A Streptococcus bacteria. This is completely different than the viruses that cause most sore throats. Here's the key statistic. About 80 to 90% of sore throats in children are actually viral. That means the majority of throat pain that your child is complaining about will not be strep and will not need antibiotics. But here's why strep matters. If it's left untreated, it can occasionally lead to complications like rheumatic fever or kidney problems, and it can cause problems later in life, like massive heart issues. That's why we test for it and treat with it when we have it. The challenge is that strep can be sneaky, especially in younger children, and it doesn't always present the way you might expect. So let me break down the typical differences, starting with what we see in school-age children and teenagers. Typical strep symptoms include sudden fever onset, sore throat, headache, red swollen throat with white patches or streaks, or sometimes it looks like a rash back there, swollen lymph nodes in the neck. Sometimes the kids will have a sandpaper-like rash on their chest and back, but they won't have a cough, they won't have a runny nose, they won't have cold symptoms. Now, on the other hand, a viral throat infection would be kind of a gradual onset of sore throat. It'll be bad in the morning when they first wake up. It'll get better through the day. And again, it'll repeat that cycle. They'll have more of a mild sore throat that hurts just when they swallow, but not any other time. Kind of a scratchy sore throat from the drainage back there. Often accompanied by cough, runny nose, sneezing, sometimes a low-grade fever or no fever, and general body aches, and a hoarse voice. Okay, so now here's where it gets tricky. These classic presentations really apply to the kids 8 and older. Younger kids often don't fit the textbook plan. Stomachache is the main primary complaint. Nausea or vomiting. They won't want to eat. Sometimes they won't have a sore throat at all. They'll have nighttime fevers, and you're like, oh, it's better in the morning, but then it always comes back at night. They'll have headaches. They'll have just general fatigue and crankiness. And they'll have vomiting happen like in the middle of the night, not related to food ingestion. I can't tell you how many parents I've had bringing a child in thinking they have a stomach bug, only to discover it's actually strep throat. They might only vomit once or twice. They might complain about belly pain and seem tired and feverish, but never do anything else. But so if your little one is complaining about an unexplained stomachache, fever, fatigue, seems more unwell, and has random vomiting, please go and see your provider and get tested. So how do we test for strep? There's typically a quick throat swab that we do in the office. We get results within 10 minutes, and it's about 90 to 95% accurate in most cases. Sometimes we can miss a strep case if it's too early onset, or if the swab itself wasn't a great swab based on what the provider did. But you can pretty much count on those being accurate. But if that provider is worried that they're not catching it, they might send that throat swab off to the lab, and then you'll have that confirmed positive or negative within a day or two. Here's something important. We don't test every sore throat if your child has an obvious runny nose, cough, gradual onset of these symptoms, and it's not always necessary based on the viral symptoms that would coincide with a sore throat that's not strep. But follow your parent gut. I always trust mom's instincts. If you feel like your child needs to be tested, please advocate for your child. I would rather err on the side of caution than go with a missed diagnosis. If your test comes back positive, then we need an antibiotic. First line treatment is amoxicillin. That's usually our go-to choice. For penicillin allergic kids or kids that have had rashes with amoxicillin in the past, usually we will go with cephalexin or azithromycin. The key point is finishing your antibiotic the entire course. Even if your child feels better, which they often do within a day or two, you have to complete that course or it's going to come right back. We don't want to spread that germ to anyone else in the family as well. Your baby is still contagious for 24 hours after starting that first dose. So don't plan on a soccer game later that night, even if your baby's feeling better. And symptoms should start improving, like I said, pretty quickly. So what's the typical timeline? If your child is not improving after 48 to 72 hours of your antibiotics being on board, call your healthcare provider. They might need a different antibiotic, or we might be dealing with a viral infection on top of strep throat. Don't forget pain relief. We can still treat pain relief even being on an antibiotic. So use your Tylenol, use your ibuprofen. If your baby is old enough to gargle with salt water, have them do that. Use popsicles. Sometimes whatever we can do. I don't care about them eating. I don't care if they are too uncomfortable and not feeling great enough to eat. I just want them hydrated. Also keep in mind that strep is very contagious, so preventing spread in the household is important. For 24 hours after that first dose, you're contagious. So make sure they're quarantining just a little bit, no sharing food or drinks in the house, lots of hand washing. Isolate your little one for that first day, and everyone should be washing their hands pretty frequently. We don't generally test household members without having symptoms, but if someone in the house is always getting strep or is at high risk, you can always ask about the policy. Watch your family members for, again, same type of symptoms: sudden onset sore throat, fever, abdominal pain. If multiple family members develop symptoms within a few days of each other, definitely have them come in. One thing I always remember to tell my parents in the room: change your baby's toothbrush. After about 48 hours of being on the antibiotic, we want to get a clean toothbrush for clean mouth. We don't want to reinsert those germs from before they were treated into a clean mouth once those antibiotics are done. Also replace any lip balms, lipsticks, anything else that goes in the mouth during the illness. Returning to daycare, your baby must be fever-free for 24 hours without needing fever-reducing medicine, or they should have been on antibiotics for at least 24 hours. Your child should also feel well enough to participate in activities. We don't want to send a kid that's still struggling with fatigue and loss of appetite back to school. They're not going to do very well. Let me leave you with a few key takeaways. Most sore throats are viral and don't need antibiotics. In kids under 8, strep throat also presents as an abdominal pain and random vomiting. Sudden onset of symptoms is more concerning than a gradual onset. Testing is important when strep is suspected. We don't want to guess here. If it's strep, complete the full course of antibiotics and replace the toothbrush after 48 hours of treatment. The bottom line is trust your instincts. If your child seems significantly more unwell than a typical cold would cause, especially with fever, throat pain, abdominal pain, it's worth having it evaluated and ruled out. Not every fever and sore throat needs a trip to the doctor, but when you're uncertain, and especially if you have a kid with a classroom full of sick kids or a younger child who's showing symptoms that aren't typical for a cold, it's better to get checked. If this video helped clarify when to be concerned about strep, please give it a thumbs up, subscribe for more pediatric health information, and as always, when in doubt, don't hesitate to contact your healthcare provider. We're always here to help you navigate these common childhood illnesses, and you're never left alone. So thanks for watching. I hope this helps you feel more confident in recognizing when you might be having strep throat in the house, and I'll see you in the next one.